Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Dr. Nandita Mohan and let's look into today's reports. Adverse pregnancy outcomes associated with an increased risk of midlife stroke. Stroke has been for a long time a leading cause of death and disability, especially in women. While the incidence of stroke in older age groups is decreasing, stroke and stroke risk factors in younger and middle-aged women are on the rise. A history of adverse pregnancy outcomes is associated with higher odds of midlife stroke. Adverse pregnancy outcomes included preterm delivery, low birth weight, preeclampsia, placental abruption, and even stillbirth, as published in the study in the peer-reviewed Journal of Women's Health. Nearly 4 in 10 women in the sample who suffered a stroke before the age of 60 had a history of adverse pregnancy outcomes. The results of this study suggest common adverse pregnancy outcomes may offer a glimpse into women's cerebrovascular health and a unique opportunity to implement primary preventive strategies in a population at high risk of future stroke. Exposure to metals, toxic metals tied to atherosclerosis risk. Previous studies have evaluated that the association of metals with subclinical atherosclerosis are confined mostly to the carotid arteries. A recent study in the journal Atherosclerosis, Thrombosis and Vascular Biology reported that exposure to toxic metals including cadmium and titanium, arsenic among employees at a car assembly plant is related to subclinical levels of atherosclerosis. The risk was found to be greatest among older employees, men, and those who smoked at any time during their life. The results supported cadmium and arsenic and identified titanium and potentially antimony as risk factors for atherosclerosis. In individuals without clinical disease, exposure reduction and mitigation interventions of these metals may reduce the cardiovascular risk. Lithium use, a friend or foe to kidney health. A preclinical study has shown that lithium has a protective action against tubular injury. However, previous clinical studies have demonstrated the association between lithium and acute kidney injury at toxic blood levels, but the risk of acute kidney injury has otherwise not well been studied. Lithium remains the most efficacious therapy for a significant proportion of patients with type 1 bipolar disorder. Despite the therapeutic advantages, the use of lithium has been decreasing, at least in part because of the perceived risks surrounding the use, including the potential for nephrotoxicity with long-term use. In a recent study, researchers have reported that lithium use does not have a direct impact on the incidence of acute kidney injury. However, they noted the lithium intoxication, the duration of exposure, as well as the lithium levels in the blood might increase the risk of acute kidney injury. Use of certain hair and beauty products may impact hormones, especially during pregnancy. We all need some amount of me time in our life in terms of personal care and even beautification for that matter. Personal care and beauty products contain several ingredients that often include a wide range of endocrine disrupting chemicals, including phthalates, parabens, phenols, parabens, and even toxic metals. These chemicals, they interact with the hormone systems, influencing their synthesis, regulation, transport, metabolism, and even hormone reception, which are all especially vulnerable during the pregnancy period. The National Institute of Environmental Health Sciences and National Institute of Health funded study published in the Environmental Research examined the association between personal care product use and the levels of sex steroid hormones, including estrogens and progesterones and the thyroid hormones among pregnant ladies. The researchers said that the alterations in hormone levels, especially during pregnancy, can have vast consequences beyond health at birth, including the changes in the infant and child growth, even the pubertal trajectories. Additional research should address the public health impact of exposure to chemicals in hair products in pregnant populations. Vitamin B12 deficiency tied to increased risk of depressive symptoms in community dwelling. The deficiency and poor status of B vitamins such as folate and vitamin B12 are very common in the elderly population. Estimates of vitamin B12 deficiency in people over the age of 50 range from 5 to 40% depending upon the method of measurement and the deficient cutoff used. Low B12 status can result in megaloblastic anemia, permanent demyelinating neurological disease, paresthesia, and reduced cognitive function. In a large population representative research of older persons published in the British Journal of Nutrition discovered that poor B12 status was related with a considerably elevated risk of depressive symptoms over a 4-year period. There were no correlations found for folate, while future prospective research and randomized trials employing an agreed upon set of harmonized measurements and blood biomarkers are therefore needed, however, to completely determine the value of vitamin B12 in the prevention or delay of the onset of depression in older population. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.